The Bohr effect is very simple to understand when we look at the structure of hemoglobin. 2 alpha, 2 beta, and also an iron core in the porphyrin rings. This is important because this creates the affinity for oxygen when there's a high level of oxygen. Because hemoglobin wants to bind to oxygen, it's the best way to carry oxygen. So when we look at the dissociation curve, we see a sigmoid curve, because with the increase in partial pressure of oxygen, you're obviously going to reach a saturation point. There's not enough hemoglobin and there's not enough in the structure to bind to oxygen, so you reach a plateau. When we talk about respiring tissues, we have to notice that there's low levels of oxygen, but very high levels of partial pressure of CO2, because aerobic respiration has a byproduct of CO2. And the way CO2 is carried in the blood is through bicarbonate mediated. And so you have an increase in hydrogen ions, which you can find out a lecture at the end of this video. But the increase in hydrogen ions obviously decrease pH. So pCO2 at high levels and low pH shift the whole dissociation curve to the right. This is known as the Bohr effect. And these two factors are vital to memorize. The shift is obviously because there's less of affinity for oxygen to hemoglobin. And that's all. That's the Bohr effect.